I want to thank our panelists for the concerning the 7% budget cuts. We're going to call forth the panel that deals with the governor's overtime restriction. Mr. Frank Mecca, who's the executive director of the County Welfare Directors Association. Karen Kessler, who is the California Association of Public Authorities. Deborah Doctor, Disability Rights California. Rebecca Malberg, SEIU. Christina Abbas Hamilton, who is going to provide introductory remarks for Cindy Chapman, who's also a provider with ASME, and Mark Beckwith, which is a consumer from Alameda County. Want to remind all of you, we do have signs up here. We're trying to keep some time going. You know how long these hearings can go, so we want to give you your opportunity, but also we know we have a number of public comments to come afterwards, as well as members may have some comments. So starting with Mr. Frank Mecca.
Thank you, Madam Chair. Frank Mecca, Executive Director of the County Welfare Directors Association. In the interest of time and splitting up the testimony, I'm going to address the administrative viability and adequacy of the funding for the FLSA proposal, and other witnesses on the panel will address other aspects. I don't mean to suggest that we only care about the administrative aspect. The human aspect of this proposal is very important to us as well. But in the interest of time, with respect to the administrative viability and the adequacy of the proposal, the first thing I'd like to say is that it looks to us like the Department of Social Services made a very good faith effort to fund the workload associated with their proposal as they conceive it. They've met with us a number of times. The impressions that we're giving today are based on the written material that we've received, a lot of verbal answers to questions, but there are many aspects of the proposal that are still yet to be explicated. So some of this is a function of assumptions that we make about that which has not yet been explicated. So given that our analysis is somewhat incomplete, but certainly there's good faith with respect to the attempt to fund sort of the associated workload. However, there clearly is a significant difference in point of view between my members and the administration about the complexity and the administrative implications of the proposal and the viability of the implementation timeframes. So our differences of opinion over the complexity of the proposal yields differences of opinion over how much work it would actually be to implement. So this is not an issue of motive, but it is an issue of a difference of opinion about complexity. And I'm going to touch on just a couple of issues very quickly. The first is the implementation time frame. All of the pieces have to be in place, obviously, by January 1st, but in reality, it has to be in place much sooner. We need times to recruit providers, to receive and record workweek agreements. Consumers need time to recruit new providers. CMIPS 2 needs to be programmed and tested. Consumers and providers need to be educated. Social workers need to be trained, et cetera, et cetera. It's an awful lot of work to launch something of this magnitude. There's also a couple of specific areas where we definitely have a difference in degree of confidence about our ability to, as a state, to implement the proposal as it's been presented. We believe, for example, there'll be a significantly greater workload associated with questions and concerns that come from consumers. The budget assumes 10% of consumers will call us with questions that will resolve within 15 minutes each. That seems exceptionally optimistic, in our opinion. We believe that there'll be more significant assistance required of clients who are going to need assistance with timesheets and tracking their providers. We believe that there'll be significantly more workload than the administration anticipates with respect to helping enroll new providers, because consumers will need additional providers under this proposal, both at the outset and for consumers who lose a provider based on a second strike. And we believe that there'll be a significant amount of work with respect to timesheet corrections. I know I got my conclusion. So as we move forward, I think it's important, in light of prior efforts like the CCI and other proposals, the complexity of launching this proposal and the complexity of actually implementing it, I think we have to very carefully work on. I think the administration is committed to working with us on it. But I think this is a much heavier lift than has been presented thus far.
Ms. Kessler, yes.
Karen Kiesler with the California Association of Public Authorities. There are public authorities in 56 of the 58 counties, and one of our main jobs is to provide registry services, matching consumers with available providers. We're very concerned that it will be difficult to recruit enough providers to make the backup system work or for our registries. Public authorities already struggle to have enough workers on the registries, and many of the people that we have on our registries want extra hours so that they can get extra income, but they will cap out at the 40 hours and not be available for services. Also, matching consumers to available providers is going to be a huge challenge for us to match people that have the right training, the right language skills. We already really struggle with that. And then we question whether we can provide at all out of either registry services or provider backup services, paramedical services, which under state regulations require that the provider be under the guidance of the licensed health professional of the consumer. The provider backup system will have to have 24/7 availability, and the administration on Monday just released further clarification that this provider backup system is supposed to actually provide a worker within 2 hours. Our systems currently do not have that capacity. That will be an enormous challenge. Also, we think it will be essential for backup providers to be guaranteed some level of pay, where we have experience in about half a dozen or more public authorities in San Francisco in their on-call program. They found that workers would go out to a locked apartment complex, the building manager would not let them in, or the consumer might not like the provider that was dispatched by the on-call system, and that worker has made a good faith effort to show up and provide those services. So some level of guaranteed pay would be required. Also, it is really essential that the backup provider system be linked into CMIPS 2. We've heard interest, and I think good faith interest, by independent living centers and by private for-profit contractors about engaging in this business. But if other providers, whether they're ILCs or private sector, don't have access to CMIPS 2, they run the risk of referring somebody out then that could be capping out over the 40 hours, not eligible to work, and then be subject to the termination. We have a lot of concerns we've expressed to the administration that we're willing to work with them to try to address these concerns, but our top priority is for the legislature to fund overtime.
Okay. Deborah Doctor.
Thank you, Madam Chair, members. Deborah Doctor, Disability Rights California. Our top priority is to have overtime funded as well. I'm going to make 4 quick points. The first is false assumptions. As Ms. Kiesler has said, there is absolutely no evidence that there are 40,000 or 50,000 people just dying to become IHSS workers in this state. That is an assumption that's built into this proposal, that when those 37 or however many thousands of people have to find a new worker, that somehow that worker will present him or herself and be, as Karen said, the right age, gender, speak the language, be suitable, and all of that. Separately, there's the assumption about an emergency backup system. Can you picture in the areas of California that you represent that there will be, what, by helicopter, somebody arriving within 2 hours to do that care? I mean, I can't picture that. Secondly, speaks to the values of this legislature. Do you really want the state to spend $37 million on more social workers and more bureaucracy to avoid paying overtime, to avoid paying services? The third point is that this is the most fundamental change in the IHSS program that has ever been contemplated, and it should certainly not be done as part of a budget proposal. This fundamentally changes the relationship between the workers and the consumers. They now have to police each other. The consumer, you're putting the consumer and the worker in a totally different and almost adversarial position where the workers, as you pointed out, Ms. Grove, the workers' hours are cumulative. So a consumer who employs a worker on a Friday who has legitimate needs, the worker's going to have to say, sorry, no can do, I had to work an extra hour for somebody else on Monday. And the last point is, and again, Ms. Grove, thanks to you, that I want to bring up this issue of unnecessary institutionalization, people ending up in nursing homes. There's a law, the Americans with Disabilities Act. There's a Supreme Court decision, the Olmstead decision. It's binding on the state of California. It says that unnecessary institutionalization is against the law. So insofar as this proposal results in unnecessary institutionalization, the state is putting itself and, of course, consumers at risk. Thank you.
Thank you. Rebecca Malburn.
Sure. Good afternoon. My name is Rebecca Malberg. I'm the Home Care Director at SEIU, United Healthcare Workers West. And it's disappointing to be sitting here that the idea that the state of California is attempting to deny home care workers of rights afforded to every other worker in the country 76 years after the passage of the Fair Labor Standards Act is appalling. Since 1938, with the adoption of the Fair Labor Standards Act, working Americans are guaranteed basic protections, such as being paid overtime. However, workers defined as companions were exempted from the Act's protection. Those exemptions were due not based on an analysis of the work, but in large part to the racism and sexism that was so common at that time, given that the workforce then, as it is today, is primarily women and people of color. IHSS providers are not casual providers or babysitters. They work tirelessly, and these jobs are physically and emotionally demanding. They work much harder and have a much harder physical and emotional job than many jobs that do receive the protections of the Fair Labor Standards Act. Last year, President Obama directed the Department of Labor to issue a rule that included home care providers under the Fair Labor Standards Act. The president was righting a historic wrong, and the governor's proposal stands in the way of that progress. The governor's proposal is to avoid paying overtime by simply prohibiting any worker from working more than 40 hours a week. That would cause workers who work for consumers with the highest need to lose 43% of their income. The proposal breaks the fragile bond between home care worker and consumers and dooms home care providers to an endless cycle of poverty. Home care consumers are the employers of IHSS. Why should a consumer have their choice of provider limited simply because the governor does not want to pay overtime? No other employer in the state is forced to staff that way. Why should IHSS workers be the only workers in the state who are exempt from this basic workplace protection? The economic argument for the governor's proposal is weak. The administration seeks to create a complex, convoluted, and confusing system to help consumers find new or emergency providers. The chaos, misery, and increased hospital and nursing home costs of this proposal far outweigh the limited financial benefit. We implore the legislature to implement the new federal rule as written. Sadly, the governor's proposal perpetuates the racist and sexist policies of the past. California can and should do better.
Christina Christina?
Hello, Madam Chair and members of the committee. My name is Christina Boss Hamilton with UDW AFSCME, and I'm here to introduce Cindy Chapman, who is a provider from Roseville.
Hi, my name is Cindy Chapman, and I'd like to start today by sharing a quote from First Lady Rosalind Carter that's really important to what we're discussing here today. She said, "There's only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." I'm a mother of 5 children, ages 15 to 33. I'm also the caregiver for my 24-year-old son, Nathan, who has mild cerebral palsy with mental retardation that causes him to operate at about a 6-year-old level. Nathan's a very innocent and loving young man. and I'm very glad to be able to care for him in our own home. He requires constant supervision and needs help with things that most of us take for granted, like taking a bath, brushing his teeth, preparing a meal. He also has delayed speech, and we're currently looking into getting him a communication device so that he can be understood more easily by others. He goes to a day program that he loves. He has friends there, and he likes to talk to them and us about his favorite things: video games, movies, music soundtracks. Those are his biggest passions. This week, his favorites are Top Gun and Captain America. Being a provider is a gift, but it also comes with certain challenges and sacrifices. Typically, when your kids get older, you have opportunities to seek out other avenues for your life. Stay-at-home moms can find work outside the home and go on vacations, even retire. I'm unable to do those things. I'm locked into his schedule, and there isn't any flexibility there. If I want to go on vacation or take a weekend away, it's a lot more difficult. I'd have to arrange for someone who Nathan isn't as comfortable with, or who may not be as familiar with his needs, to care for him. Nobody else can take care of Nathan like I can, so when he gets invited places, I have to go too. It isn't always easy, and it typically costs more. IHSS is an incredibly important program to me and my family. Without it, I don't know how we'd be able to put food on the table. With the 8% cut in hours last year, we're already struggling to pay our bills. If the governor's budget goes forward and bans providers from working more than 160 hours a month, I will lose about 30% of my income. And with that kind of loss, we could lose our home. Additionally, the proposal would bring in a worker from a temporary pool to make up for the hours taken away from me, would be a significant disruption in Nathan's care. Like many others with special needs, Nathan doesn't adapt to change as well. His happiness relies on knowing that his mom will be there to care for him, to make his meals, take care of his personal needs, along with providing the feeling of security that can only come from a loving family member. Bringing in a stranger who doesn't know how best to meet his needs would devastate him and jeopardize his care. Being cared for in his own home by someone he knows, trusts, and loves allows Nathan the stability he needs to be able to have a higher quality of life. Facing the 30% cut in my hours has left me wondering what I'm going to have to do if this budget gets put in place. I don't think I could afford to continue to care for Nathan and meet my family's needs, which might force me to put him in an institution so that I could look for work outside my home. Now that Nathan's an adult, it would terrify me to put him in a group home. He's my son. The best provider for him is me. Best place for him to be is our home. This program keeps hundreds of thousands of Californians in their homes where they are well cared for and can live with dignity. Please do what's right for me, my son, and my family, and all Californians who need and provide care. As Rosalind Carter reminds us, this is something that impacts each and every one of us. Please invest in home care. Thank you.
Thank you. Mark Beckwith?
Yeah, this is Mike. It's good. Can you hear me all right?
Can you move the mic up? Okay. Yes.
My name is Mark Beckwith. I'm a consumer from Alameda County. I've served on the board of the advisory board of the Public Authority for 10 years. Over the years, I'm not on there right now. I just termed out. But I was also around when we started the Public Authority in Alameda County. And this proposal is totally unworkable and unrealistic. And it shows how little understanding the administration has of the nuts and bolts of what goes on in my life every day. That they think they can just send someone out. Oh, he's been trained. Well, really, I've never even met him before. How does he know how to lift me? How does he know all my little idiosyncrasies that will cause me pain or injury? I can teach them. I have to teach each of my attendants how to do that. But I don't have, I mean, I'm going to have an opportunity to pre-train these people. Now in Berkeley we have a substitute attendant program funded by the city of Berkeley. It costs a lot more to have somebody available on short notice than what the governor is proposing. People are not going to sit around and agree to do nothing for weeks at a time during the month on the off chance they might get a call and get an opportunity to make a whopping $15 an hour. Because they'll get $3 more than a regular attendant. That's not going to work. You have to have somebody on call, paid to be there, and when they get there, like when I have to call easy does it, I have to cut my routine short, say, well, no shower today, maybe I can get on the toilet, and then get into my wheelchair. But all the other stuff I would normally do, maybe brushing my teeth or something like that, just has to be skipped. And this is going to happen a lot. And I have, I'm on the waiver, I have 24-hour care. So calling around and saying, hey, I need somebody tonight or tomorrow night from midnight to 8 in the morning. They're not going to be able to do that, I don't think. It's just unrealistic. And this really has disabled, my disabled friends and consumers are very frightened and worried about how this is going to work because we know it's not going to work. The county staff doesn't have the personnel, social workers to explain to people, oh, you're terminated now because you work too long. You know, if I get sick or have a problem that comes up and I get stranded or whatever, my attendant has to stay with me and help me. And if I get sick, they're not going to walk out and like leave me there until the next attendant comes. So I just think that this isn't a practical proposal. And I think that in the long run, to really find a program that would work, it would never be as good. It erodes my choice as a consumer, which is very important to me, to control my own life and make my own choices. And these people who visit my house are not chosen by me, they're not trained by me, and it won't work. So I think that in the long run, to get something, it's going to be cheaper to pay for the overtime than to deal with the fiasco that's going to come from this futile effort.
Thank you. Thank you very much. I want to thank all of our panelists so much for the information as well as trying to hear. I know it's difficult to adhere to this time limit of 3 minutes, but most of you made a good, valiant effort to do so, and I really appreciate that. We have a number of persons who want to address for public comments. We're going to ask that we've been asked to have those in wheelchairs to come first. You want to comment? While they're coming, let's have our wheelchairs come first. Mr. Chesbrough has some questions.
I just wanted to also thank the recipients and actually all the panelists, but especially the recipients and the providers, especially those who've traveled a long distance from the far reaches of my district. I know it's a big deal to get to Sacramento, especially when you're trying to take care of clients or loved ones. I'd just like to tell a really quick story. I'll try not to try your patience. But a few years ago, many of us will donate a lunch with the legislator to a charity for an auction. And there was a charity and only one person bid on having lunch with the assemblyman. And it turned out, and I had no idea who it was, and I didn't know until we met for lunch, but it turned out it was an IHSS provider, and he got it for a really good price. Fortunately, because I don't think he could have afforded it otherwise. But he spent the lunch hour telling me what the experience is like, both for the people he serves and his own experience. And I just think we all ought to take a legislator to lunch with a provider, because I think it's a real eye-opener to hear firsthand, directly, and in detail. I'm glad the Olmstead decision was mentioned, but you know, we have a legal and a moral obligation. But the other thing is that institutionalization costs far more money. So it's sort of on 3 counts. You know, it's under Olmstead, a legal obligation, and I think we all up here agree that we should give people the most independence that we can, and it's also a very serious financial matter. And finally, I'd just like to say something that I haven't heard yet in these hearings this year, but we've talked about in previous years, which is the cumulative effect of all the cuts. Many people who depend on one program depend on multiple programs, and so these things pile up and become the sum of the whole is much greater in terms of the impact on people's lives. So I just think this proposal really ignores the reality, day-to-day reality of people's lives. So thank you for your indulgence, Madam Chair.
Thank you. Yes, thank you very much. We're going to go to our public comments now. We've reserved 1 minute per person, so I know that's a little difficult, but I think in addition to, are these all the ones over here who want to address these two issues? Okay, that are in wheelchairs. The others can line up behind them, so we can get a sense of the number of persons who want to have public comments on this issue of the 7% cut and the reduction in hours. Okay? Okay, very good. Very good. Thank you so much. We'll begin with the first person. Make sure you give us your name, where you're from, and you can share with us your position on these items. I assume that you're opposed to it, the recommendations, but feel free to do that. We won't have a lot of time to hear an awful lot of stories, but you can share with us some information you think would be helpful in making this decision. So we'll begin with our first public comment.
Good afternoon, and thank you very much for allowing me to speak. First of all, I'm Francisco Godoy. I'm a member of the HSS Advisory Committee here in Sacramento. Also, I'm in the Board of Directors at Resource for Independent Living. However, I wanted to express my own opinion. I'm a quadriplegic as a result of an accident, and I believe this proposal would be a total chaos for us. In fact, I feel we're under attack because the fact of the matter is that if you guys cut the hours to 40 hours a week, that's going to be like a hook because instead of getting better care, every time we had to go to the doctor, we got to share those hours with our providers. And the state has right now revenues about over $6 billion. So I believe that this raise, this overtime, it should be accommodated. In fact, the CMPS guys, I don't think it will work. In fact, they have a savings of $20 million from the transition that they got on the paychecks. I think that money should be allocated to restore the 7%. Thank you very much.
Thank you.
Habla tú de una vez.